Welcome to tonight's virtual gala. I am Dr. Pietro Carpenito, Executive Vice President and Chief Medical Officer at Richmond University Medical Center. One of the upcoming improvements to our hospitals in the next 12 months will be new surgical suites, including a new pre-op and post-op surgical areas. I am an anesthesiologist and have spent the last 42 years of my professional life in the operating room. Although a tiny percentage of our hospital's total footprint, operating rooms have a huge impact on hospital budgets. Operating rooms, on average, drive up to 60% of our hospital revenue, responsible for 40 to 60% of the organizational total supply cost, produce more than 30% of a facility waste, and 2/3 of its regulated medical waste, can consume 3 to 6 times more energy per square foot than anywhere else in the facility. This brand new surgical suite has been designed to reduce energy consumption, supply cost, and waste generated in the operating rooms. The plan is to build 10 state-of-the-art operating rooms, 1 sister room, and 1 isolation room, all supported by 23 bedded bays. Each room will be provided with state-of-the-art lighting, booms, and integrated technology. Video monitors will have the capability of remote consulting to physicians' offices and to conference rooms for education. As medical treatment advances, more equipment is being used in the operating room. Some of this equipment, like our robotic surgery system, is large in size, requiring large operating rooms to accommodate it. As our hospital's main goal is excellent patient care, we continue evolving to provide the best physical environment for patient care, and the new surgery area is a good example of that evolution. Improved workflow and efficiency are another benefit of our new surgical suite and pre- and post-op surgical areas. The new perioperative suite will allow the separation of ambulatory patients from the inpatient and trauma patients. This improved workflow will increase patient, surgeon, and staff satisfaction.
I'm Dr. Philip Otterbeck. I'm the Chairman of Medicine at Richmond University Medical Center.
I'm Dr. Lauren Harris, the Chairman of Surgery at Richmond University Medical Center, and welcome to the new surgical suites at Richmond University Medical Center. The most exciting thing about the new surgical suites is that they're going to be brand new, almost double the size of our present operating rooms, with all state-of-the-art equipment, and this will make the patient stay and the patient's outcomes better.
When my patients come to the hospital for a surgical procedure, they not only want a great surgical outcome, which we've always delivered at Richmond University Medical Center, but they want a great patient experience. And that starts with really the seamless design of the operating suites, where the patients come to the preoperative area and very smoothly go over to the operative area and then subsequent to the postoperative recovery area. This will improve both patients' outcomes as well as patients' experience in the overall process.
Since we're on the second floor, which is just above the emergency department, patients who are in need of emergent trauma surgery will be able to come from the emergency room to the operating room within minutes, which in many cases can be life-saving. Surgeon efficiency will be vastly improved, and that leads to happiness amongst the surgery staff, increased number of cases that can be performed, and that is the #1 way to recruit new surgeons. The first impression of our patients is when they arrive for their surgery in the morning, and the new suites are going to be beautiful, state-of-the-art, and give them a very comfortable feeling about where they are and what they're about to undergo.